Welcome to Deuk Spine Institute. We are broadcasting spinal surgery live today for you, for your viewing and listening enjoyment. I'm Dr. Deuk Majan, CEO and founder. And our patient here is having horrible back pain. He has 3 discs that are damaged. He has some facet arthropathy. Show us the facet arthropathy. We're not treating the facets today, we're just treating the disc. And he's a big guy. We're trying to get into the disc at 5-1 on both sides. Right. Shot. Wasn't entirely happy with that. Shot. These are the regular needles. Shot. Shot. When I say shot, folks, I'm asking for an x-ray picture. Shot. Is he reliable?
How you doing, my friend?
Shot.
You okay? He says yes, he's okay.
I'm just having a hard time seeing my needle. And I'm right on his facet. Shot. Let's try this. Shot. Any pain? Shot. Yeah. Interesting. All right, let's get a guide wire and a long needle. So he's a pretty big guy, 300 and somewhat pounds, and a lot of soft tissue that I have to get through, and it's maxed out my needle. So I'm going to switch it out to a different needle. We're going to use a special long needle. Sometimes we have to use the long needle. You're doing great. Hang in there. If you have questions, feel free to ask us. We do take questions during surgery. At this point, we're just starting this procedure, and the first step is always to get our needles in place. Shot. All right, I'm going to take this guide wire back out, put the stylet in, so I can navigate the needle. And we use the X-ray machine, which you're seeing those pictures, for 2 purposes, navigation and localization. Shot. Navigation means to get somewhere, right? Navigate somewhere, and localize means to figure out where things are so that you can choose where to navigate, right? Any problems? You feel comfortable there? All right. I'm going to try to redirect this thing and get us right where I need us to be. Shot. I'm struggling a little bit because L5-S1 is the hardest disc to get to, and you're not making it any easier for me. There, I think I'm where I need to be. Where do you feel it? I can't hear him. You've got to listen.
From the buttocks down to your toes?
All right,
mid-calf?
I think.
Buttocks to mid-calf, he's feeling it. Buttocks to mid-calf, not the toes.
Doesn't go all the way down your leg?
Buttocks to mid-calf, yeah. Back of the leg.
That could be the facet
Back mid-calf.
or the disc. Injection. I want to see if I'm in the disc. If not, we have to redo it. Shot. How bad does that hurt? What's the highest it goes? 1 to 10?
7.5.
8? Is that where you get your pain? Is that where you typically get your pain?
Yeah.
All right. So we got an 8 out of 10, concordant at 5-1. All right, very good. It's going to make it a little harder for me to do the other side, but I'm going to go ahead and finish the right 3-4 and 4-5. I'm going to make my incision. I'm going to wait for the dye to dissipate a little bit. You're doing great, by the way. Oh, regular. Okay. We're going to make basically a centimeter long incision. And now we're going to do the needle placement for the other 2 discs we need to do. I don't know if I can get both, but I'm going to try. Shot? Good. We should be able to get the other 2 through 1 incision. Henry, show our audience how is it that a disc injury can actually be so painful for patients. Shot? Besides the pain I'm creating through surgery.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals.
Shot. With that video, folks, you can see that discs cause pain through a process called inflammation. Shot. Are you cutting? Yeah, you're cutting down the window. Shot. Wow, I'm just getting pushed around here. It's very strange. Shot. There we go. Perfect. Shot. At this point, I'm just trying to navigate these needles into the disc, right where the herniation is. And if I can get that done, then the rest of the surgery goes pretty smoothly. AP, where do you feel it? I can't.
Where are you feeling it, my friend? Right where the needle is. He's feeling
Okay. Nothing down your leg, right? Okay, lateral. Oh, look at that other one. Perfect, huh? 4-5. All right, you can see for the discogram at 5-1, Jordan, the dye is in the disc. He's got a damaged disc, tears both sides, dye leaking out both sides. Big leak on the right. All right, lateral. Okay, interesting. I guess the 4-5 looks good on the AP, but not the lateral, and that's why you always get 2 views. Shot. 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 Huh?
What are you saying? That went down the right leg.
How far down?
To the shin bone.
All right. Shot.
Mid-calf.
Yeah. He's definitely got pinched nerves, so. All right, Henry, let's show the audience what it is we're trying to do with this laser here. Shot.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
Okay, welcome back. We are still in the process of trying to access the L4-5 disc from a transforaminal approach, which means through the foramen, and everything's going well. It's hard because of his body habitus. He's got a lot of soft tissue, and we knew this case would be hard, but we don't run away from hard. We still want to fix people. If we selected just easy cases, we wouldn't be helping as many people as we help. Any pain?
Where is it? Back right side.
All right, I like back right side.
Yep.
Shot. So I'm banging against the top of that vertebral body. I need to make a small adjustment. Shot. If I can. This is what we call needle jockeying. I didn't make up the name, but shot. It refers to the act of whipping around your whip to get it right. That feels like herniation there. Nice. All right, good. One more to go.
We're going to do a discogram, right?
Yeah, I want to. I already did one. Shot. Any questions from our audience, Henry?
Yes, we have a question from, forgive me if I cannot pronounce this first name. I'll go by the middle name, which is Mercy on Facebook. And Mercy asks, how can cervical spondylosis be treated? Spondylosis pain be treated?
Well, Mercy, the best treatment is the Deuk laser disc repair, and I can have Henry show a video of what that is. Henry, do you have that video available?
Yes, I do.
Let's go ahead and show Mercy. Show some mercy. Shot. Almost done, my friend. Shot.
Disc injuries are a common cause of chronic back pain. Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, you get to go to sleep.
Here we're going to go nice and slow. It's got CPAP in.
Welcome back. You can see that the best way to treat cervical spondylosis pain is the Deuk laser disc repair. That's through the front of the disc. We go in with a laser and endoscope, find the tear causing the pain, clean it out with a laser. Same thing we're doing with the lumbar, except we approach it from the back. In the lumbar, we approach it from the front in the cervical. I want to start with 2, 3, 4. Okay. We've just completed the discogram. It's called an evocative discogram. Want to see if those discs are causing his pain, and indeed they were. The L3-4 was 10 out of 10, the L4-5 was 9 out of 10, and the L5-S1 was 8 out of 10. Now we're going to get started with the laser procedure to go in. Show us the tear at 3-4, Jordan. Look at the size of that tear, folks. Huge. That's where the back pain comes from. When the back pain a patient has comes from a disc injury, it comes from the tear in the back of the disc. That was what we discovered at Deuk Spine Institute. We're the first to discover it. Henry, let's show the audience the 30 most common causes of chronic back pain. This Numb them? Yeah. I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk. Thanks for joining us. And welcome back. You can see from the video that disc injuries are the #1 cause of chronic back pain, accounting for 85%. Here is the injury. The blue is the herniation. It's stuck in these white areas, which is the annular tear. And this causes horrible inflammation, which then causes pain. But lots of little nerve fibers here, scar tissue, bone, calcium. All this gold color is calcium. Comes from chronic inflammation. The pink stuff is the granulation tissue. That's where you find the little nerve fibers. Any questions?
At this moment, no current questions.
All right. Well, we've covered a lot of ground. You guys have seen the Deuk laser disc repair cervical. Luis, do we need more scopes?
No, because
Huh?
we have like 9, but 2 yesterday went down. So
Yeah, so we need more scopes.
I can order more. I mean, use.
Can you find used?
I can find one maybe.
Find some
10,000,
used.
10,000,
Yeah. And if you can't buy, I want 2 more.
2 more.
Actually, 3 more.
3 more. Okay.
You know, we should not stop collecting them. Always look. Because the truth is if you have 2 days in a row like this where we're doing so many cases, and you have some scopes that go down like we did,
Yeah.
you need them, right? You need them. Did anyone see our Virginia patient this morning? Virginia, Indian. Yeah, I didn't see him this morning, and I think Cassie. Huh? Cassie told me that I had the 2, which I saw, Indiana and St. Petersburg. Oh, that's why. Got it. Thank you. You explained it.
How's our friend from St. Petersburg?
He's doing amazing.
He had a great recovery.
Yeah, he said his numbness in his leg is not completely gone, but it's on its way out. But he still has facet pain, which we told him he's going to have, and he needs to fix with the Deuk plasma rhizotomy. He's preparing himself to come back and get it done. He should have had it done yesterday. I don't know why he didn't. But some people, they don't believe me. Then they find out that I was right. All right, any questions, Henry? Look at that herniation right there.
At this moment, no current questions.
All right, so this is the first surgery for the day. We have 4 more.
Where are you watching the fireworks tomorrow?
I'm not going to watch fireworks. I'll be home. I've got a meeting in the morning with my web team and Sanjay. And I think Henry might be there. His latest video animation. I think he's got the cervical DLDR done, right?
I believe so. I can will ask Sanjay for that to let Tom Bean know. I think they were sending the text over for that, and
yeah, I already sent the text over.
Yeah, so like he should be done with it.
I sent the text for one of them. I don't remember what it was.
Yeah, he should be done with it soon, though.
I'll have to find out. Why don't you call Sanjay and ask him to come talk to me in 30 minutes when I get done. Let's find out what we're... How about you, Berndes? Where are you going to watch fireworks from?
I have a friend coming in from Vegas, and we'll probably go watch him down in
Vieira.
Fort Lauderdale or stay in Boca.
Yeah?
Yeah, he's coming in. To Fort
You know,
Lauderdale.
they have fireworks over in Vieira, I think, right? Over by the stadium.
Oh yeah, I went there with him last year. He comes every 4th of July, so we went last year. They had fun there.
They may even have a parade, if I'm not mistaken. Like a 4th of July parade. All right, so for those of you watching, you see a little bit of fat right there. This is the back of the disc right here. There's the foraminal ligament. You could see the tear. This is at L3-4, big tear. But once you clean the tear out and get rid of the herniation and the scar tissue and the granulation tissue, the tear is not that big because the inside of this tube is 5.5 millimeters wide. So what we're seeing is a tear that's about 2 millimeters, right? And this will seal. That's an annular tear, a tear in the annulus. This will seal nicely, but it takes about a year. Why? Because there's no blood supply. The annulus has virtually no blood supply, very little. And it gets its nutrients through diffusion. Diffusion is a process where basically biochemical molecules move in space through a process of diffusion down a concentration gradient where in one area it's higher than another. Think about if you fart in a room where there's no air circulation. Eventually everybody will smell it, but it takes a while for that gas to diffuse around if there's no air movement. Sorry, I couldn't resist.
Yeah, my friend is coming. You know him. You have Dr. Scott Young.
Yeah. All right. Well, there you have it. There's the tear. See how small it is now? We clean it up. We got rid of most of the herniation. There's still a tiny bit left I'm going to try to get. But this is where all the pain comes from. When we showed you the video on what causes disc pain, this is it. Inflammation right here where I'm working. And a little bit of fat right here. Fat's just getting in the way. Fat's normal in this area. People have fat here. And that fat is the source of energy, right? And I just want to make sure we got all the herniation out of here. So I'm going to open it up just a little bit more. But to me, it looks good. Yeah, it looks real good. A little bit of lateral herniation right here. The lateral herniation is not as important unless it's pinching the nerve. The nerve is going to be just outside this tube. I'm pretty happy with that. That's really nice. The nerve will be right up there. You see the nerve? There it is, the white thing.
Yes, we do.
That's the dorsal root ganglia. Look how close it is to the tear and the herniation, right next to each other. You got fat, you got a vein, you got the nerve root. Henry, why don't you get a picture of that?
Copy.
Right there. Give that to Sanjay. Let me see if I can make it better. Let's turn, hold on. Let's turn the light. Let me stop the flow. Go ahead and get a picture of that. You got it?
Yes, sir.
All right. And then, yeah, that should be good. Point is, that's a great picture for the website to show how close the tear and the herniation are. We're done with this level. We're going to move on to the next. And the nerve root, how close the nerve root, the tear, and the herniation are to each other. Give me the other stuff. Give me the irrigation. I don't know how long this guy is going to last. Right? In the prone position. Does he have the CPAP on?
Yeah, you want to do this?
Huh?
You want to do all the
Take. Only what? Yeah.
We're going to try our best not to oversedate and not try to get the right dose.
No, I'm trying to keep things moving. You know, it's because it's only going to be a matter of time before he gets tired and of breathing. Let's go. Shot. Any questions?
Yes, we have a question from Regina
Shot.
on Facebook.
Yeah, hi Regina.
Asking, how do you fix pain in a growing area that goes to the front muscle down to the knee?
That's a great question, Regina. The first thing we have to do is make a diagnosis. What's causing your pain? Take it. That could be something called lateral femoral cutaneous neuralgia, or Neuralgia paresthetica is the other name for it. Neuralgia paresthetica. That's what that could be. On the other hand, it could be your hip. Yeah, no worries. Just lay still. You're doing great. On the other hand, it could be a hip problem with your hip, or it could be a labral tear. So there's several different diagnoses that cause that symptom. You need a Deuk spine exam. We offer a free MRI review. You're welcome to use it to get a diagnosis. That usually is the best starting point. After we have a diagnosis, we know what to do to treat it. Okay? That's what I would say. Anyone else that doesn't use that algorithm is just guessing. And that's why people like you stay in pain for so long, because the doctor's guessing. They just give you pills or shots. Nothing actually fixes the problem. At Deuk Spine, we don't guess. We make a diagnosis, and then we do a treatment. Lay still, you're doing all right. Just lay still. Hold on. Shot? Yeah. Just take your time. Take your time. Safety first. I think I can deliver this through if you want. All right, we're in. Hard part's over. Hard part's over. Yeah, no, he's got a lot of pain. It's amazing how sensitive these discs are. Okay, take it. All right. Good. We're done with the stimulating part for now. Shot. Great. Perfect. Any questions from our audience? Lay still.
No current questions, but I believe we do have a comment and or
Nope.
seeking advice from Asim on Facebook.
Sure. Happy to help us, Sim.
Asking or saying, sir, my L5 to S1 disc has slipped since 2011. I feel much pain in my back.
We can help you, Asim. You need to come to Deuk Spine and let us fix it for you with the laser. But start with an MRI review. Henry will post the link, fill out the paperwork, send us your MRI images and the report by CD or link to the portal, or swipe your DICOM images over so that we can have them. This is a relatively fresh herniation. This is a slip disc here we're dealing with at L4-5. And this disc herniation is fresh, recent, in the last probably, certainly within 5 years. And it could be as early as 3 months ago. It could be as long as, 5 years ago. But this disc herniation is definitely not that old. It's not years and years. It's more recent. What's that for, guys?
Yeah, seal 3M. 2 inches or 3.
Perfect. Look at the tear right there, Henry.
Yes, sir. We see it.
Let's go ahead and run the video one more time on how the Deuk laser disc repair works.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. And you can see right here we have a tear in the back disc. It's in the back wall of the disc called the annulus. Now this one here and this part of the herniation appears a little bit older. Could be a couple of years old. The blue thing moving up and down is the laser fiber. It's the plastic cover of the laser fiber. The actual laser fiber is the glass in the middle.
Can you let me know when you have about 5 minutes on that?
Yeah, of course. On this one here,
Yeah.
this one we're almost done. We're at less than 5 minutes.
I'm gonna try to stay ahead of it a little bit.
Yeah, we're about 5 minutes max. Just about done. We're almost done with this disc. Any other questions, Henry?
At this moment, no current questions.
By removing the blue stuff, the herniation, it's going to allow this disc to heal naturally, without metal, without fusion, without bone graft needed. Other doctors don't do this treatment. They don't know how to do it. They're not trained to do it. And they're not capable of doing it because of that. They're too much into doing their fusions. They love fusions because fusions and artificial discs pay the surgeon a lot more money than these procedures do. So the surgeon is motivated financially. Fusions and that the patient will have to come back and get a fusion later. Thanks. So once again, our tear is much smaller than it was before. At the beginning of this disc procedure, the tear was about 6 millimeters, 7 millimeters long. There's a piece of herniation I just pulled out. Again, these pieces of herniation I'm taking out with either the laser or the pituitary, they are preventing the tear from healing. And we want this tear to heal. If we can get this tear to heal, the pain goes away completely and stays away. So the more of these little fragments of herniation I can get rid of, the higher chance the pain goes away and stays away, because the tear in the back of this patient's disc will heal properly. All right. Move it over for me. Not right now. All right, we're done with this disc. Wonderful. I think the pain he had in this disc is going to be gone. We got rid of the inflammation, the inflammatory tissue, which is the heart of the pain. Looks good. Once again, the nerve is going to be right there. See how close we are to the nerve root? But the nerve root's protected throughout the surgery from my laser and instruments. All right, we're going to move on to the next disc. Scope off. I got it. We're going to move on to the 5-1. He's a very challenging patient, not just from a surgery standpoint, but from really an anesthesia standpoint, mostly because he's very large and difficult to ventilate when he's asleep. He has sleep apnea? He has sleep apnea, has his own CPAP, so he has a machine at home that breathes for him because he gets tired breathing. He's big. He's got to lift all that weight with those muscles around your ribs and diaphragm to get those lungs to expand. All right? And he struggles. So right now with him asleep, he's breathing on his own. Fine, shot. But the truth is, we don't know how long he's going to be able to keep breathing on his own. Let me have it. Num num. So we want to work expeditiously before we have any issues. That was a lot of num num. Shot. All right, let's try to fix this disc. Shot. Unfortunately, he's so big that it's really hard to see too, right? Shot. Is that it there? Shot. And yeah, his anatomy is not normal. Let me just take a look and a feel. Gotta try to get as medial as possible. Shot. And the facet is forcing me down. Shot. I've got to try to counter that effect. Shot. I think we're okay. Let's see. Shot. Normally I do 5-1 first, but I couldn't do it with all those other needles in the way. So I had to get them done first. You can see how deep he is. This tube is almost completely buried in his body, so his spine is anterior, makes it even harder. Facets are enlarged, makes it harder. Disc is collapsed, makes it harder. It's just really a challenging case for us, surgically and anesthetically. All right, we are in the disc, that's for sure. Laser. Bring me that thing. When you're doing 5-1, you're going to be positioning yourself as a surgeon really towards the head the most. So you need to move all your equipment north towards the head. I got probably 5 minutes on this disc. There's a big piece of herniation right there. It's very, very firm, very tough. If I had to say, this is an older part of the injury. This is not a fresh, new in the last year. This has been going on for a while. When did he have his injury? 14 years ago. Yeah, this is definitely in line with that injury. Wow, very firm. You guys see the difference? Not as much blue, not as much fluffy, a lot more white, scarry tissue. Very different. All right. Everything's going well so far for this patient, which I'm happy about. There's some granulation tissue, inflammatory tissue right there. This is all the stuff pinching his nerves, scar tissue, herniation, all together, mixed up together. Just bad. Bad stuff. Questions?
No current questions, but we do have a comment and or seeking advice from Eric on Facebook.
Sure.
Saying, I have pain in thoracic, numbness and tingling on the left side from my face down to foot and will go away when I lay down. I know I have a 2 millimeter aneurysm on my brain on the left side. I already had an L4 to S1 fusion in 2019. I'm from Ohio.
Wonderful. From Ohio. Cannot help you with the aneurysm, unfortunately, but we can help you with thoracic pain and back pain or leg pain or pinched nerves. The way to do it is to use our free MRI review we offer to everybody, no charge. And you get basically one body part reviewed. In your case, I'd consider thoracic, unless you're having lower back pain as well. And I will actually figure out where your pain's coming from on Zoom without you having to come to Florida. I'm pretty good about it. I'm about 95% accuracy. And as long as you can help me by pointing on your body where the pain is, I can usually make that diagnosis over Zoom. Okay? So we do a little physical exam. I have your MRI images, which you send us in advance, and I have your report, which you send us in advance, and I do 10-minute Zoom call with you, and in that 10 minutes I can diagnose what's wrong and how to fix it. I am a neurosurgeon, but I don't treat aneurysms, and I am not the aneurysm guy. I wouldn't know what to do. I haven't treated an aneurysm in a long time. 4 minutes on this one. Yeah, we're close.
I'm just trying to time before you drive mistake.
Understood.
That equals in position.
What steak? I mean, I have pizza for lunch.
What's that?
So what steak? I have pizza for lunch. Yep.
We have a comment or a question from Eric once more on Facebook.
Sure, yeah. Of course.
They did ask, thanks so much. How do I send the info? I did put the link for the MRI.Deuk.
Yeah, just use the link and follow the instructions, Eric. That's the best advice I can give you. I can't explain the rest. You have to just follow the instructions. There's a nice video in there that Henry created on how to submit your MRI, the images. You can get a copy of your CD with the images on it from the MRI center where you got your MRI and mail it to us. Don't expect us to mail it back because we won't. Remember, we're offering you a free service. We're not going to pay for postage and mailing. Unless you want to send a self-addressed envelope, in which case we will send it back in a self-addressed envelope when we're done with your review. Other than that, you're welcome to use a portal, login credential, link, username, password, and that way we can download your images, have them ready for your review. Or you can get them on CD and sweep them onto our portal on our website. Those are your options. And those are your only options. Or you can bring it here in person. But in the end, we can't use JPEG images. They're not diagnostic quality. So don't even think about taking a screenshot with your phone, because we will not accept it. All right, just about done. Another minute here and we'll be done. A lot of scar tissue and granulation tissue on this one. Any other questions, Henry?
At this moment, no. Oh, we just got another question from Becky on Facebook.
Sure, I'd be happy to
And
answer Becky's question.
they asked, do you ever have any incidents of wound dissonance?
Dehiscence. No, we don't. Nope. No, wound dehiscence happens when you get an infection in your wound. And they call it dehiscence because if they say you have an infection, they'll scare the hell out of you. But you have an infection if you have wound dehiscence. And you'll need to have that treated with antibiotics after you get it diagnosed, what's causing it. But that happens with other types of spine surgery, not with our procedure. All right, we are done with the right side. We're moving on to the left for one level. And let me show you before he comes in. Look how small the incision is. Everything done through that tiny, it's about a centimeter, 10 millimeter incision, 3 discs. And if he had had to have the alternative treatment, it would be a fusion. Fusion would take away his back and leg pain if I did it with the decompression. It would be a 6-hour surgery. He would be laid up for weeks, if not months. So the fact he's having this procedure instead, he's going to be back on his feet today, going out to dinner. He can't drive today. He can drive tomorrow, but he could go back to work tomorrow. And there's no pain medication, and we don't have dehiscence of the wounds. Never had an infection. Of course, there could be a first one. I'm sure there someday will be, but I've not had an infection. You have any num-num? Are you labeling your stuff?
Yeah, yeah. I know what they're doing. That's just he pulls out of the arm restraints. It's just,
Huh?
sometimes he pulls out of the arm restraints. That's why.
Oh yeah?
Yeah. He did it twice already.
You don't like that?
No. Then I gotta call Henry for help.
Henry.
Yes, sir.
Dr. Byrne does big muscular guys.
Oh, yeah.
And he's trying to keep them under control.
Yeah, whenever he needs, I'm around.
Shot? That's it? All right. Shot. Now, 5-1 is the hardest disc to get to for any transforaminal surgeon. Pressure there. And you can see there's a little bit of bleeding. Everybody's different. Some patients more than others, but if that bleeding gets inside the muscle, which it's going to in everybody, it's going to cause some spasms of the muscle over time. And everybody's different, but, give me an AP. The blood in the muscle will break down. It takes months and months for it to go away. And as it breaks down by the body and dissolves, it releases hemosiderin, and hemosiderin is very, very spasmodic. It causes spasms of the muscle spasms. So causes inflammation, which then causes muscle spasms. Shot? Man, this is really, I'm not sure I can get in here. Nope. Solid bone. We're done. There's no way to get in. The facets on his left side are just so enlarged and arthropathic. Yeah, look at that. We even bent the wire trying to get in. You guys see this, Henry? Move out, please. Go, go, go. See the wire?
Yes, we do. Wow.
Yeah. Yeah, there's no way I could get in.
On, please.
Pay attention.
Thank you. Thank you.
Any questions?
At this moment, no current questions.
All right, well, we got all 3 painful discs fixed. I just couldn't get the left side. We tried. We had to abort it. But that 5-1 disc should be fixed from the right side. So we're going to be good. Yeah. Yeah, there's too much osteophyte, bone spur, bone hypertrophy on the left. I don't think that's causing his back pain. It may be pinching a nerve. We'll have to wait and see. But usually when you get that much bone, hey, Jordan, can you move this, please? I had a Ray Tech off the field. When you get that much bone in the facets on one side, it means that that side is kind of socked in and it's not moving. So if it's not moving, it's not causing symptoms. Huh? Scope use is a 8. All right, if you have questions, type them up. If there's no questions, you can end the broadcast. We'll be back later with a cervical Deuk laser disc repair.